Good day viewers, I am Dr. Soumil Vyas. I am a consultant liver, gallbladder and a pancreas cancer surgeon at the Sir H.N. Reliance Foundation Hospital, with my focus of clinical interest being liver cancer, pancreatic cancer and gastrointestinal cancer, including cancers of the stomach, colon and the intestines. Today I am going to speak about liver cancer, what we should do and what are the treatment options and modalities that are available to us. Liver cancer is an increasingly common condition. We have two fundamental types of liver cancers, which include cancers originating within the liver substance, what we call as hepatocellular carcinoma. This is an increasingly common cancer that we are seeing all over the world and particularly in India, and that is largely because of the increasing incidence of chronic liver disease or chronic parenchymal liver disease, which is also referred to as cirrhosis. There is a 10% chance of patients with cirrhosis developing a liver cancer on an annual basis. The other type of liver cancer that we also see increasing in incidence and may be related to cirrhosis is what we call as cholangiocarcinoma. Cholangiocarcinoma is a kind of tumor arising within the livers and can arise within the bile ducts and is specifically related to the origin of tumor cells within the biliary system or the bile ducts. And the third variety of cancers that we see within the liver is tumors which have spread into the liver from other organs. So you could have a cancer in your large bowel, intestine, the colon, which goes into the liver, causing what is called as liver metastases, and likewise virtually any organ from where the cancer has originated can metastasize to the liver. Treatment of liver cancers is complex and requires a multidisciplinary team approach with a liver surgeon, a hepatologist and a medical oncologist. Whenever we detect a patient with a liver cancer or a cholangiocarcinoma or even liver metastases, the fundamental process is to stage the disease completely, which is very often done with a dedicated PET scan and with a dedicated CT scan along with certain specialized software, what we refer to as a CT volumetry. This gives us an idea about the volume of disease, the extent of disease within the liver, what the condition of the rest of the liver is, and that helps us to plan our treatment. Fundamentally, the treatment for liver cancer, wherever possible, remains an operation, as it remains the only definitive treatment for removal of the tumor with appropriate and adequate margins. In certain select cases of liver cancer, hepatocellular carcinoma in the background of liver cirrhosis, liver transplantation is a very viable option and has excellent results. We analyze the case on a patient-to-patient basis and decide which treatment suits the patient best. Likewise, cholangiocarcinomas are also best served with an operation, and an operation should be planned wherever possible. We make estimates about how much liver to remove through specialized dedicated CT volumetry software. Nowadays, in tertiary care centers like ours with excellent anesthesia and ICU setups, liver resection or removal of part of the liver is a safe and a standardized procedure with a very low complication rate. We could remove up to about 60 to 70% of the liver depending on the condition of the liver, and this would involve and this will be very helpful even for patients with very large liver tumors. Likewise, even where patients have liver metastases, that is cancer which has spread into the liver, we can select out patients and offer them curative treatments with a combination of liver resection. Where liver resection is not possible, we could also use certain other additional modalities like thermal ablation, what we refer to as radiofrequency or microwave ablation. We could use modalities like transarterial chemo or radioembolization to downstage the disease and then make them amenable for a subsequent operation. Chemotherapy has a fundamental role in decreasing the disease burden and making borderline patients operable. So in a nutshell, a patient presenting with a liver tumor, which could be either a liver cancer, cholangiocarcinoma, and patients who have liver metastases, would be served best through a dedicated multidisciplinary team approach. Correct treatment planning is fundamental and of importance. Correct assessment of the treatment by a liver surgeon in combination with a dedicated liver radiologist goes a long way in helping these patients get the right treatment and achieve the best outcomes.